Marshal Tonoring, Marshal Tonoring, Anyayo Amnonohan, Josh Marshal Tonori, Tamata O Amnonohan, Marshal Tonoring, Marshal Tonoring, Anyayo Amnonohan, Josh Marshal Tonori, Tamata.
I was on what they call an advisory committee, and the group was very passionate about what they did. They were determined to build a facility in spite of the cost. They were very determined to bring their people home. This past year, we were honored by Harvard University in their project, which is called Honoring Nations, with an award. It gave us an opportunity to share our story, and we feel that the information that we have given will help others perhaps be as successful as we are. This facility opened in November of 2003, and it's located on sort of in the middle of the reservation, close to the Mexican border, on Indian Route 15. When we share our story about success, we always mention passion, that we feel that if someone doesn't champion the idea, that probably it just won't go. In our case, it was a group of ladies who just kept approaching the nation, asking that, do we have money now to start the program? And then it moved to an advisory group, which actually, by that time we had money. So, and we also you also need a government that listens to the people and who honors the elder, because I think we've seen a lot of times when someone said, yes, we do honor our elders, but there was no action taken to care for them. In our case, we have executives who followed through with the money, appropriated the money, and this gave us the ability to move forward with the building, staffing, and the programs that we have here. The funding for the facility comes from gaming, but not all of it. 1/3 is from we're reimbursed by Altex, which is the Arizona Long-Term Care System, and which is Medicaid. Then there are a few that are on Medicare. We also are licensed to take veterans. So if we do, the Veteran Administration would pay for their care here. There are very few private pay. The rest, anything that's not paid for by any of these entities, then our tribe then pays for it. As far as jobs go, we have, especially all our managers, they are all O'odham except one, and they've all had special training. We've been able to have consultants come in and work directly with them, help them with policy making for their specific department, help them, even if need be certified. So this has been a very outstanding thing for the people here on the reservation.
But after a couple of months of being here and having the board, dealing with the board, working with the board, I happen to have the opportunity with the administrator, who also runs another facility, who has their own HR department and was willing to provide that training for me. So the board allowed me to do that, set up a contract where she would monitor me and give me some advice and help me upgrade my skills that I already had in place.
We truly bend over backwards to bring our staff in and to keep them. We have bonuses for our nurses. The benefits for that the nation provides for all their employees are very, very good. This includes medical care, dental care, and 401k. We do have housing, and we have housing also that takes care of the shifts. For instance, if we have a person on a 12-hour shift and they want to spend a couple of nights here, we have facilities for them. In the area of communication, we do try to communicate quarterly with the districts, with our oversight committee, with the executive. And we do feel that any plan that we have, we try to maintain transparency with everyone so that there are no surprises to anyone. And then we also get their input. We find now that planning is very important. And we try to be very sure that we implement. It's not just a plan that's put on the shelf. We do work at implementing every goal.
In addition to the Archie Hendricks Skilled Nursing Facility, we also have the hospice program. And the hospice program is taking care of O'odham people that are reaching their life's end. Before we had hospice here on the nation, our people had to go out to the city and the hospitals, Tucson, wherever they're sent, to get hospice care there. So this is a good thing for our people. I worked as a CNA on the nursing unit before I transferred over to the hospice care. And I wanted to work for my people.
We have a mission. This mission has not been changed since I've been, because it's such a strong mission. It sets up the reason for our existence, and we feel very passionate about it. It talks about continuum of care, and that's one of the new passions that we have. Is hoping to put together a model that of continuum of care for our aging population. We do have, beginning with the nursing care facility here. We also have started an organization or a consortium. It's called the Elder Care Consortium, and we realized that there were many issues, and this group alone could not solve the problems. So this is how the consortium came into being, and it consists of the Tribal Health and Human Services, the Indian Health Service, and the community college, and of course us. So the four entities meet monthly. We talk about the issues of aging, and we have put together a white paper for the new administration so that they see what we see, and we also have a few recommendations for them. We will continue to update that white paper as time goes on.
I worked with children. I worked at a school, and then from the school I went to elders, and I enjoy doing what I do. I love it. I like being a clown. I like, letting the residents know that we're here for them. And we did wonderful. I didn't understand their language. Now they're teaching me how to say